Good afternoon. Thank you very much for the opportunity to share my thoughts with you. I'll introduce myself to you because I think I'm not as well known to you as many of the others are. I'm Beatrice Wood. I'm a licensed psychologist. I'm also board certified in family psychology, and I am a professor tenured at the University of Buffalo. But my remarks are my own opinions and don't represent those of the department and the university at large. I've had the good fortune to serve children and families in the mental health arena for over 35 years. I was trained at the University of Pennsylvania at Children's Hospital of Philadelphia, and I've been here in Buffalo for 20 years. I love it. I respect the community, and I'm just so proud to be participating in this venue today because I think it is so very important. I'm not going to read my remarks because much of what I have said has already been presented to you. However, one thing that you may not be aware of is that it's not an accident that Western New York CPC is so successful, because it was designed intentionally with state-of-the-art contextual and family systems theory and knowledge and research. So they knew then, they were very clear that the physical context, the psychosocial community context, and the family context are key pieces in the healing and the redirecting of maladaptive functioning in children and families. So this was really a state-of-the-art place, and still is, obviously, with database. On the other hand, I am not aware of any evidence that shows that ramping up community-based crisis service does the same thing as consistent, intensive treatment to redirect in a sustainable way the difficulties that the children and families are having. So it makes me very nervous to think about reallocating funding for that sometimes Band-Aid approach, because you cannot provide that kind of intensive treatment without a team that has psychiatrists, psychologists, nurses, and a group community and healthy, safe context. I just don't see any evidence that that works. There's a place for it. It's essential. But to redivert funding for that reminds me of the 60s when we closed the doors to the adult inpatient long-term psychiatric facilities, and now many, many, many of those people are in our jails, homeless and in our jails. So it's really penny wise, pound foolish, I'm afraid, to think about saving that money. In fact, I actually would like to throw a monkey wrench in and say what we ought to be thinking about from a financial and from the well-being of our children is increasing the beds at places like CPC. Big grounds out there. I think we should increase that opportunity. So, and then one other thing, part of that is the staffing. It has been emphasized that really the staffing makes a difference. That's true, but the staffing live in, work in a context too. And I'm not so sure that we will be able to recruit and retain the kind of excellence in staffing at a place like BPC with children, where people will feel so overwhelmed by trying to be helpful to children and families in a physical context that has so many things going against it. BPC is an amazing place. I admire the staffing and the administration and even the patients. I go over there every week for grand rounds, and I'm moved by it. But I'm also just daunted and heartbroken by the context itself. It's just, even the buildings are daunting and depressing. And children really need hope, and family needs hope. And, you know, if you just put a kid in elementary school, you put them in a little special classroom to get a little bit of extra help, they say, I'm retarded, I'm with the retards. You put children in the same context, even if they never see another adult who's chronically and persistently mentally ill, they know where they are. And they're going to believe that's who they are and that's where they're going. And I think that's a real kiss of death for these kids. So I would say, in conclusion, if it ain't broke, don't fix it. And if it's really working, make more of it. Thank you.